This is Steve Zeltzer with Workweek, and joining me is Jeff Ruch with Peer, and he's recently taken up a position around the issue of health and safety and CalOSHA and its effectiveness in protecting the workers in California. Welcome to Workweek, Jeff.
Hi.
Why don't you talk first about your organization, what you do?
Peer, Public Employees for Environmental Responsibility, is a service organization. We help employees who work in environmental and public health agencies like the EPA and Fish and Wildlife. And we were contacted by CalOSHA staff who were concerned about the low level of staffing and lack of leadership both at headquarters and in the region and district offices, resulting in a slump of activity at a time when, due to the COVID pandemic, workplace health in places like hospitals, nursing homes, food processing plants, and the like are key factors that, for the most part, are being addressed. So there's roughly about between a fourth and a fifth of the inspector ranks that are vacant, and they have a backlog of unsafe, unhealthy workplace complaints of about 3,000 and growing, as well as a few hundred reports from employers of employee injuries, illnesses, and deaths that have not been investigated.
And in the midst of this pandemic, we've never had, in over 100 years, a pandemic and a virus epidemic like we have now. What does that mean for workers in factories and in their workshops and their work locations, that there is no functioning CalOSHA? Because it seems like that's kind of what you're saying.
We describe CalOSHA as AWOL. They're absent, and they're supposed to be there. And even in the governor's latest announcement that they were doing exercises, CalOSHA admitted that most of their interactions with the workplace are by phone, which is difficult to address unsafe work conditions by phone. They're basically not deploying, and one reason they're not deploying is they're not testing their inspectors. So part of what just happened was the governor kind of ordering a Potemkin-style exercise that had nothing behind it, and the inspectors that were sent out weren't tested themselves, so they may or may not be spreading the disease. We don't know. It resulted in no enforcement actions, and so as we understand the trajectory, CalOSHA will continue to decline. And the thing about it is that CalOSHA at one period, and in a prior life I worked in the California State Legislature for the Labor Committee in the Assembly, where we led the charge to restore CalOSHA after it was eliminated by George Dicmajian. And in past decades, CalOSHA has been a national, even international leader in workplace health and safety, but I don't think anyone would call the current period of CalOSHA its golden age.
Well, this decline of CalOSHA and lack of staffing is not new. It happened under Governor Brown, Jerry Brown.
Right.
So this has been going on for decades, actually, hasn't it?
It's been going on for years. I don't know about decades, but it's been a number of years. And in 2015, we filed a complaint with federal OSHA, which is supposed to exercise oversight over the state programs that have been delegated enforcement. And they actually, Fed OSHA, this is under President Obama, made findings that were critical of the current state of the agency, and the CalOSHA promised to reform. And fast forward 4 years later, and nothing's been done. If anything, the situation's worse. There was a short spike in hiring under Jerry Brown following that Fed OSHA complaint that Peer filed, but then they didn't replace the vacancies as they occurred, and they've not, for example, hired a single inspector in calendar year 2020. So this year, nobody's been hired.
So at a press conference on June 15th, there was a protest at the Tesla factory by some workers demanding the hiring of 1,000 CalOSHA inspectors. Governor Newsom said that it was a foundation of CalOSHA and his responsibility to protect the workers, the 19 million workers of California. Do you see that as questionable when there hasn't been new hiring at CalOSHA?
Well, it's hard to say that he's fulfilled the promise because there hasn't been new hiring, and of those workers, a good percentage of them are not English speakers, and there's only a handful of inspectors for CalOSHA that speak Spanish. Moreover, there's not even a Secretary of Industrial Relations, which is the cabinet post. So at the Newsom cabinet table, the place for worker health and safety is vacant, and has been since he was sworn in.
And the issue of the Department of Industrial Relations, the former director of that, Christine Baker, who was enveloped in a scandal, left that position and then became a member of the Fraud Assessment Commission, and which was she was appointed to by former Governor Brown, and then Governor Newsom allowed her to take that position. What does it say about the Department of Industrial Relations that it's empty at this point, and that the former head of it had to leave in disgrace, really, because of nepotism, putting her daughter on, and the corruption in this agency?
I guess I'm more concerned that it's still vacant. So the scandal happened before Gavin Newsom became governor. He was lieutenant governor. But to me, sort of looking forward, the fact that there's nobody there, and that vacancy is compounded by additional vacancies in headquarters, the regions and district offices, as well as the ranks of the inspectors in the field. So, largely speaking, it's hard to say that this administration has yet to make a commitment that's identifiable to worker health and safety.
Now,
you would think that this would be the time you want to make it, because workplace exposure is one of the main factors, if not the main factor, driving this pandemic.
And many workers that I've talked to or we've talked to have said that they called CalOSHA, never gotten a return call. In some cases, they've been told by CalOSHA inspectors, in the case of the Tesla plant, for example, that the Department of Public Health is in charge of health and safety at the Tesla plant. What is going on?
Well, I think that's why we said they were AWOL. They're not there, so they're not responding. And the fact that the inspectors aren't being tested, even for the few that deploy, is also troublesome. So this is a key workforce, and that's why we thought it was important to call attention to the holes in its ranks.
And as far as the protection of workers, do you think that there's a possibility that the infection, COVID, might be spreading from these factories, from these workplaces into the community?
Well, yes, because the people that are in them, and it's not just factories, nursing homes, medical facilities are also workplaces, and those are big sources of infection. And one of the concerns is CalOSHA, to the extent that they're not be tested, when they go into the workplaces, they may be spreading or returning with exposures that are potentially life-threatening.
Now, another issue has been the nurses have been very unhappy with the fact that CalOSHA apparently has dropped their standards for airborne disease, which COVID is, to the COVID, the CDC standards as far as masks and other protection. You think there's been a change in the handling of health and safety protection standards from California and adopting Trump's standards?
Well, I don't know whether they've formally adopted the standards, but they had adopted the federal standards or relaxed the state ones, but they're sure not enforcing the state ones. So I don't know that there's been a formal change in policy, but in terms of kind of a bottom line, are they enforcing the longstanding rule about airborne infection? They're not enforcing it.
And the issue of CalOSHA, I know employers in California and nationally really would like to regulate themselves. They have voluntary standards that they want, guidance, which is what Trump has said in the meat plants, voluntary guidance. You think that the whole atmosphere or culture is one of let the companies regulate themselves?
Well, certainly in the Trump administration, I didn't know that was the attitude with respect to the Newsom administration, which is why we thought the vacancies at CalOSHA were so concerning. But the idea that you can just expect compliance without any enforcement is a fool's errand. And we see the same thing with respect to pollution violations, where industry is expected to self-regulate, and not surprisingly, they report 100% compliance, but when every time they're checked, they find high levels of violation.
And if this is a common operating procedure and seems to be systemic, isn't that the capture of these agencies by the very companies that are supposed to be regulated by them?
So I don't know whether CalOSHA has been captured, but it appears to be empty. So it's hard to capture a vacuum.
And the legislature, you have the Labor Assembly Committee. Where's been the California legislature as far as oversight and making sure that CalOSHA does have a staff to do its job and protect the workers of California?
Well, they've not yet been evident, though I must say they have their hands full, and they've just put out a budget. And notably, the new budget document didn't even, while it continued funding, it didn't mention CalOSHA as an area of increased emphasis.
And why is there disconnect? Because it would seem that the workers of California should be entitled to, and under federal law, the protection of health and safety of workers seems to be a critical requirement on the job.
I'm not sure, and I also don't see labor unions as aggressive as they were. Sometimes people joke that the labor movement's an oxymoron, but if the labor movement was a little more emphatic, I think they would see results in terms of CalOSHA's posture. But we're not hearing from them either, and CalOSHA appears to be sort of shriveling on the vine.
And you think that part of that is the fact that the labor movement has been supporting Governor Newsom and the Democrats in California, that they don't want to conflict with them or embarrass Governor Newsom?
I'm not sure. I'd be hard-pressed to speak for them, but I'm not hearing them speak, and that's the point I'm making. And
what would you like to see as far as a change in policy and staffing at the agency?
Well, we'd like to see safety and health laws and rules enforced, and especially now. We can't imagine, I can't imagine more time important to enforce them. And that enforcement is going to require the ranks be filled of inspectors, and that they be given marching orders to go make sure that workers are safe and well. So this is, occupational illness, forgetting injuries for a second, when it's all totaled, is between the 7th and 8th leading cause of death in this country, and California is certainly no exception. Ignoring occupational health and safety is really of a large threat to the nation's well-being.
Okay, well, I want to thank you, Jeff, for joining us. And how can people get more information about your organization?
Our website, which is very informative, is peer.org, and the name Public Employees for Environmental Responsibility mercifully produces a pronounceable acronym.
Thank you very much for joining us on Work Week.
All right, thank you.